Jay has SC disease. The pain is real sharp in his arms and it doesn't stop. He would need transfusions to try to help him from having the pain.
Dr. Michael DeBon, a physician, a member of ASH, was taking care of sickle patients. Senator Talent visited his institution. Dr. DeBon took the opportunity of taking Senator Talent aside and showing him a family, a child with sickle disease who'd had a stroke, pointing out the necessary therapeutic interventions that have to be done with this child. These are not trivial. These children have to be treated with regular red cell transfusions.
Dr. DeBon and the head of pediatrics there, Dr. Schwartz, were telling me how messed up the Medicaid reimbursement system was for sickle cell disease. And I said, that's interesting, and we talked a lot about it, and then
I got a phone call from his office, and I thought it was a joke, actually. I thought somebody was just pulling my leg, and they said, this is Senator Talent's office, and we'd like to talk to you a little bit more about how we can make this a reality in terms of improving the health care for individuals with the disease and improving the knowledge about this disease in the African American community. I said, well, I'm going to be in D.C. in about 2 weeks, and they said, well, we thought we'd call you back in about 6 hours.
it's critical to help this historically underserved population, many of whom may not know they carry the trait or have the disease until it's already affected them. The bill allows the state legislators to increase reimbursements for treatment for sickle cell disease, like blood transfusions, which are very, very common. It provides for reimbursing for counseling and education. And then, as important, the bill authorizes 40 outreach centers around the country and a outcome center, one national outcome center, which is going to help us keep track of outcomes for sickle cell.
Dr. DeBon is to be congratulated because a single physician working with his senator was able to make an enormous beneficial change for patient care.
ASH was instrumental. They provided instant credibility. It was absolutely important to have ASH involved because they represent the heart and soul of hematology, not just pediatric hematology, but adult hematology. And they were able to independently validate that this was a need, that this bill was important, and that this bill would fill a void for this very important group of individuals.
Yeah, I really encourage people in medicine to make sure their senators and congressmen are aware of the struggles they're confronting and organize and to suggest solutions, and you really can make a difference.
And in order to take better care of our patients, we have to be very active at the national level, both in dealing with the Congress and with the related institutions, to make sure that there's appropriate attention being paid to the science.
There really is no choice. If you don't get involved in advocacy, if you don't get involved in trying to bridge the gap between our representatives and healthcare, then the system will be driven by individuals who really don't understand what the salient issues are and what the needs are. So being a physician means that you do understand the legislative issues, you do understand the advocacy issues, and that you're in contact with your local and state representatives.
All a member has to do is approach our website, and it becomes a very easy option for our members both to see the issues that we are dealing with and how to contact their congressmen and senators.
Without advocacy for our patients, we really are in a vulnerable position in not being able to provide the best care for them.
This is the sort of thing, the legislative process is a long process, and you need advocates like ASH all through it.